Hi, it's Dr. Claudia Kim again, cosmetic surgeon here at New Look, New Life. Today, we're going to talk about one of the regenerative treatments that we use in aesthetic medicine, which is PRP, or platelet-rich plasma therapy. I have talked about these regenerative adjuncts used in aesthetic medicine, and you can actually refer to these other videos on YouTube on exosomes and PDRN. So what exactly is PRP? So PRP is actually using the healing power of your own blood to rejuvenate and repair the skin. So we take blood from you and then we spin it down in a centrifuge to separate that golden layer of plasma that's rich in platelets and growth factors that are naturally circulating in your body. And these platelets are like your body's internal repair crew. They signal your cells to produce collagen, improve circulation, and speed up healing. Instead of relying on synthetic fillers or chemicals, the PRP actually taps into your own body's regenerative ability. We use PRP in several ways depending on your individual goals. You can actually inject it directly into the face, the scalp, or neck to restore glow and improve texture. We do combine it with microneedling or laser procedures where the PRP is applied topically to actually absorb into the microchannels that have been created to stimulate collagen. Specifically for the under eye area, it can soften the fine lines and dark circles naturally, and it does work great with fillers together and neuromodulators to actually maintain a natural, youthful appearance. For hair restoration, PRP actually helps to strengthen the follicles and encourages new hair growth, all without the surgery or the downtime. And PRP is also used for sexual enhancement called the O shot. So PRP is actually injected into the clitoris or the G-spot to stimulate cellular and vascular tissue growth to actually amplify sexual activities and orgasms. Because PRP is completely autologous, meaning that it comes from you, allergic reactions are virtually non-existent, and most patients describe the treatment as being quick, tolerable, with minimal downtime. Obviously, bruising can happen from just the poking of the needles and a little redness or swelling for a few days. Over the next few weeks, your body and your skin will start to look more hydrated, smooth, and radiant, but PRP results are subtle, but yet it is cumulative. It's a kind that glow that people make say, oh, you look great, or did you go on vacation? In my practice, PRP is usually not a standalone therapy. It's usually part of a comprehensive rejuvenation plan, and we will combine it with like laser resurfacing, exosomes, or radiofrequency microneedling to really amplify the collagen stimulation and improve with the skin tightening. When used strategically, PRP doesn't just refresh the surface, it can actually enhance the overall quality and health of your skin from inside out. PRP is a beautiful example of how modern aesthetic medicine can stay both natural and scientific by using your own biology to actually enhance your beauty safely, effectively, and authentically. As research continues, we expect these biologics such as PRP, exosomes, PDRN, PDGF to really become a standard add-on to many of these treatments because they don't replace them, they actually amplify it. So when we talk about PRP, we're really talking about a partner in aesthetics. They work together with your favorite treatments. It makes the recovery faster, easier, and helps your skin and hair perform at their very best. So I hope you guys have a better understanding of the new and exciting players in the field of aesthetic medicine. If you like these videos, just give me a like and a follow. Thanks.